Peezy Midstream, the innovation that transforms women's health screening. I'm retired from the NHS but was a family GP for 21 years, a forensic physician for 10, and I trained in anaesthetics early in my career. I co-wrote Symptom Sorter, a best-selling primary care reference book, now translated into 6 languages and used globally by nurses, doctors and paramedics. I invented Peezy Midstream after a female patient returned the universal container I had given her for a urine sample. She was angry and embarrassed. Both her and the sample bottle were wet. She had used the stop-start method, interrupt the flow, fill the bottle, then empty the bladder. At best a difficult process, and at worst a disaster. She complained bitterly to me that the system must have been invented by a man, and someone should come up with a better method. So I did. Peezy Midstream has been through rigorous design and user testing. It expels the first 10 to 20 ml of urine, which can contaminate the sample with bacteria from the perineum and hands. It then captures only the midstream and discharges the rest. The collection bottle fits the laboratory analyzer, cutting out decanting with its risks of spillage and environmental hazard. We combine patient dignity and hygiene with clinical accuracy and safety. Peezy Midstream was scaling in NHS antenatal clinics in March 2020, but COVID's demolition of point-of-care testing severely impacted our business. In response, we remodelled, and in 2024 we'll relaunch with improved packaging and more clinical evidence. Why is Peezy Midstream so important? Real-world data shows that Peezy Midstream reduces the incidence of mixed growth in cultured urine samples, resulting in fewer retests. It also reduces the number of samples being sent for culture by reducing the false positive rate in urinalysis, pointing to a 60% saving on lab spend by GP surgeries, and, importantly, accuracy, reassurance and dignity for women with improved antibiotic stewardship thanks to reduced prescribing. Our 3 core settings are prenatal, elderly and preoperative screening. Contamination rates in routine antenatal screening are given at 24%, leading to retesting and delay in diagnosis and treatment. Our real-world evaluations in South Wales reduced instances of contamination down to as low as 0%. In a West Hertfordshire real-world evaluation, Peezy Midstream reduced false positive urinalysis in antenatal screening, sending 30% fewer samples for microbiology investigation, a huge benefit to hospital finances and staff and patient time. In the past 5 years, over 800,000 mainly unplanned hospital admissions have been due to UTI, the majority of patients being over 65, costing the NHS over £400 million. UTI in the elderly often causes challenging behaviour, distressing for all concerned. Reducing hospital admission for the elderly is important both for NHS resourcing and patient well-being, which often deteriorates during hospital stays. Orthopaedic surgery usually requires a clear urine screening to ensure infection risk is minimised as far as possible. False positives lead to costly operation cancellation and increased waiting times. With existing and new evidence, Peezy Midstream will again be available to GPs, midwives and all clinicians keen to get diagnosis right first time, reduce antibiotic prescribing and improve the patient's experience. We make Peezy Midstream in the UK. It's made of recyclable polypropylene and cellulose, and if incinerated in hospital waste, it releases no toxins. We're working on a portfolio of new urine collection devices to assist early-stage cancer diagnosis and sports dope testing. We'll tell you more about our specimen collection next year. Meantime, if you'd like to try Peezy Midstream in your prenatal clinic or GP surgery, please write to hello@forte-medical.com. It's been good to meet you, and thanks for listening.